Like, hello, Mr. Johnson. I'm Kim. I'm gonna be your nurse today.
Uh-huh.
I'm gonna be doing a full body physical assessment. Is it okay if I touch you?
Yep.
All right. I'm gonna be answering you. I'm gonna be asking you a few questions. Can you state your full government name?
Johnson George, date of birth February 8th, 1998.
Okay. And do you know where you are?
Yep, Utopia Hospital.
Utopia Hospital. Perfect. And do you know who the president is?
Yeah, it's Joe Biden.
Okay. Perfect. And are you in any pain today?
Nope.
No pain. So if you are given a score out of 10, 10 being the worst, 0 being no pain, it'd be 0.
Yep, 0 pain.
All right, perfect. And how are you feeling today? Are you happy, sad, upset?
I'm feeling happy today.
Okay, perfect. And then I'm just gonna be checking your skin or top of your head. All right, there's no scarring, no lesions, no discoloration. Color looks good. Hair is intact, no sign of alopecia. And then, can you please look up for me? All right, nose looks normal. Mucous membrane is intact, no signs of leakage. Okay, septum is midline. I'll be looking at your ears. Again, no signs of drainage, no scarring, no lesions, no discoloration, no bruising. All right, and then what should be next? Next should be the neck. All right, can you turn to the side for me real quick? All right, no signs of JVD, no discoloration. Thyroid is midline, and then I have to assess the bilateral pulses, no, the carotid pulses, not bilaterally because it can cause the patient to pass out. All right, and then I have to oscillate the carotid to check for bruits. This one, I have to use this one, not the bell. Well, that's weird. No bruits found. Okay. Alright, I'm gonna have a smelling strip to test your olfactory nerve. Do you smell this?
Yep.
Do you smell on this side?
Yep.
Alright, perfect. And I'm gonna be performing the eye test for you.
Okay.
Covering one side. Look straight, please. There you go. Okay. Okay, pupils are reactive. No, pupils are equal, round, reactive to light. And yeah, Perla is intact. Can you look at my pen, please? There you go. 1, 2, 3, 4, 5, 6. 6 cardinals of gaze is intact. And that's called the, what's that called? It's after the 6th gaze. I forgot what it's called. Okay. And then testing the facial nerves. Could you please smile for me? And frown. Alright. Face is symmetric. And can you please close your eyes and just try to maintain the best balance as you can? Alright, and you open them back up and sit down again, please. Or actually remain standing for me. So it's going to be a negative Romberg test since he did not sway. And then I'm going to be assessing your gait and your balance. Can you please have both your hands to your sides and have one leg up? I'm going to be putting slight pressure on each side to assess your balance. Alright. Patient has normal balance. And then I'm going to be testing your gag reflex and swallowing. Let's start with swallowing. Get my pen light. Open your mouth, please. And just swallow normally. Alright, perfect. Throat has no blockage. There's tonsils are normal. And then I'm just gonna pretend I have one of those wooden sticks and I stick them in their mouth. Gag reflex is normal. Patient's gag reflex is present. And then I'm gonna be performing a cerebellum movement for the upper body. Can you please do like rapid movements with your arms? All right, present. And then can you please sit down while I rapid movements with your heels, spin them around, up and down. All right, perfect. Lower cerebellar is present and normal. And I'm adjusting your chest and arms now. Okay. Can you please have your arm like this? Perfect. Color is normal. Skin turgor. Less than a second. Patient temperature is warm. No scars, no lesions. Are you able to feel my hands across your arms?
Yep.
All right, perfect. And then this is where I'm going to ask the patient to probably like remove his shirt to inspect his thoracic cage. Thoracic cage is symmetric and normal. No signs of lesions, no signs of tumors, no signs of anything protruding out of the patient's cage. Okay. Palpate symmetric. Respiratory expansion. Alright, now just breathe normally. Palpating the respiratory expansion. Patient's expansion is normal. I believe it was +2 centimeters, right? Centimeters. And then I'm going to be assessing your brachial and your radial pulses symmetrically, bilaterally. Okay. Alright, now I'm going to ask you to pull against me. Alright, strength is normal, and then now resist. Alright, and then can you perform range of motion exercises for me? Patient's range of motion is not limited, normal, horizontally and vertically. And then I'll be checking your capillary refills really quick. Turn this way. Capillary refills are less than a second. Perfect. And then I'll be doing a deep tendon reflex on his biceps, triceps, and brachioradialis. So for the biceps. Okay. And for the triceps, what did he do for that one? I think he just... And then your brachioradialis, I believe it's going to be right here or something. Oops. Stay right there. Now I'm going to be moving down to oscillating the diaphragm. So I'm going to be assessing his breath sounds on bare skin. So the heart. Heart sound is present and normal. Now lung sounds. Lung sounds are present and normal. Now I'm going to be doing the aortic valve, which is the second intercostal, left intercostal plate. S2 S2 sound is greater than is larger than S1. Now in the pulmonic, again S2 is greater than S1. Erb's point, S1 and S2 are equal. Tricuspid, S1 is greater than S2, and then the mitral or the atrial valve, S1 is greater than S2. Alright. And how is your breathing? Is it normal? Are you having difficulties breathing at all?
No, no difficulty breathing.
Any position, laying down, standing up?
No, no difficulty breathing.
No? Okay. Now I'm going to be oscillating your posterior breath sounds. So going 1 here, 2 here, 3, 4, 5, 6, 7, 8. Breath sounds are normal. Now we'll be assessing your lateral. Release the skin. Just breathe normally. Okay, and now anterior breath sounds, which is start right here. 2, 3, 4, 5, 6. Alright, we're moving down to your abdomen area. When was the last time you made a bowel movement?
About an hour ago.
Okay. And was there any discoloration to it? Was it a different color, different smell, different texture?
Nope, look normal.
And when was the last time you had a bathroom break, which is number 1?
About 30 minutes ago.
Was the color a different color than you're used to? Was it solid yellow? Was it clear? Was it...
No odor, and the color was pretty normal, pretty clear.
And there's no difficulties, no UTIs that you know of?
Nope, no difficulty.
Okay, perfect. And then, is it okay if you lift your stomach so I can inspect your abdomen?
Yep.
Alright, there's no scars, no lesions, everything looks symmetric. Low hernia scar, so far normal. And then I'm going to be oscillating all 4 quadrants, starting with the right lower quadrant of your abdomen.
Sure.
Okay. We want to oscillate the abdomen first before we touch it, so that all the sounds that we hear is accurate. Alright. There is sounds of bowel movement, which is good, which is normal. And then now I'm going to be lightly percussing it. If you feel any pain, please let me know. Starting with the right lower again. No pain?
Nope.
No pain, no signs of any protrusions, no signs of lesions, no signs of tumors, no abnormal feelings. Alright, now I'm going to be assessing your lower extremities. Alright. I'll probably around this I would have my patient like pull their legs up, but patient's legs have no scars, no lesions, no edema, no discoloration. Temperature looks good. Are you able to feel my hands?
Yep.
Alright, perfect. And then I'm going to be testing your leg strength, so push up against my arms. Perfect. Now try to go down. Alright, perfect. Now can you perform range of motion movements, one leg at a time? Perfect. Range of motion is present and normal. And then I'm going to be assessing the deep tendon reflex of the patellar. It's going to be the back of your leg. I have it. Patellar. This one, right? One. And boing. Oh. Alright. Reflex is present. And I'm going to be assessing your posteriotibial pulses and your dorsopedalis. This one is like strong. Alright, I'm assessing your cap refills bilaterally. Cap refills less than 1 second bilateral. Alright. Now, before I go, do you have any questions?
Nope, no questions.
Alright, any thoughts of harming yourself or others?